Hi everybody. Sorry for the delay. I was filling out PPP paperwork. Fingers crossed we get some money from the SBA this week. I'm Dr. Jordan Leasure. I'm the owner and physician of North Shore Proactive Health, a state-of-the-art wellness clinic in the northern Chicago suburbs. I am a functional medicine trained DC, and we are in stress management boot camp. So put your boots on and get ready. We are talking the difference between common and normal this evening. If there's questions, as always, please hop on and let me know. While you are tuning in, say hello. Let me know if you're watching live, what you're doing, where you're watching from in the country. I know we have people all over the world tuning in. If you're watching the replay, let me know that you're watching the replay. Let me know what time you're watching, if there's a better time for you so that you can hop on live. Let me know that as well. This is all about community. It's all about us coming together and getting through this together in our own way, whatever works best for you. I found a fantastic quote that I wanted to start this evening with, and it's, I wake up every morning both determined to change the world and have one hell of a good time. That makes planning my day very difficult. That's E.B. White. I thought that was perfect, and I could totally relate. It's been an interesting time these last couple weeks, and since we don't know when this is coming to an end, we are taking it one day at a time. So I actually am going to be live in a digital wellness program tomorrow for attorneys, which is super cool. So if you know an attorney or are an attorney, Rocket Matter is doing a virtual conference. And we're going to be speaking about attorney health and wellness. And, you know, they could relate to that. So I might have to replicate this beginning of this talk tomorrow morning. So we are talking the difference between common and normal. And it may seem very obvious, you know, something for a lot of us can be common. So, hi Lizzie, thanks for tuning in. Hello Tamara, thanks for tuning in. Hello Bethany, everybody's just on board now. After dinner, it's a good time to do a talk. So something can be common, like having back pain is very common. Having headaches is very common. Unfortunately, being obese in the United States is very common, but that does not make it normal. Does that make sense? So when I have a patient come in and I say, how are you feeling? And they say, well, I'm having my normal headaches. Well, that's not okay, because there is no such thing as a normal headache. Knock on wood. I never have headaches, and if I ever get a headache, of course, my first thought is I have a brain tumor. You know, it's not that I'm dehydrated or I'm tired or I slept wrong or I'm stressed. I have a brain tumor. I have too much knowledge in my head. But all kidding aside, there's no such thing as normal aches and pains. Hello, Lisa. Thanks for tuning in. I'm glad that you're doing well. Hello, Janet. So we need, as a society, to be aware of the distinction between common and normal as a whole. And we also need to be aware of it for ourselves so that we're able to understand when something is happening to us and we need to draw attention to it, or we need to seek treatment for it. And in my estimation, that should be anytime you are not feeling as happy, healthy, and energetic as you should be. So it is okay, like the theme of this talk is, this theme of this group is, it's okay to not be okay. And that's fine. I've spent plenty of years not being okay. And there's probably people that would tell you I'm still not okay, and that's okay too. But my point is being able to know the difference and know, especially when it comes to mental health, when you're feeling good, when you're feeling happy, when you're feeling motivated versus when you're not. And in the mental health realm, that slope is typically very slow. You know, when it comes to physical health, oftentimes, and I have a pain in my hand, same thing, I was convinced I had a tumor. I made Jade x-ray it today. Thank God we have x-ray in the office. And I do not have a tumor. And I should have iced my hand today and I didn't. I used cold laser on it like 3 times and it feels better, but not amazing. But that's the thing. So usually when you have a physical pain, it comes on rather acutely and you know. So maybe you wake up on Wednesday and your neck hurts, or you obviously, fall and you twist your ankle. The time frame between feeling good and not feeling good is usually short. Now, when it comes to mental health, it is usually a much more gradual decline where you may not notice that you are no longer finding joy in things that you used to, or you're no longer doing the activities as often as you used to do, or you're not waking up at the same time, or you're starting to go to bed earlier, or you're feeling like in the afternoon you have to take a nap and you're just not happy at work, or you're not happy with your spouse. That's usually a much slower decline. Now, what can we do about that so that we take some of those common, not feeling good, not feeling motivated, not feeling excited, and turning that into feeling excited, feeling happy. And you need to be deliberate in your steps to modify those things. Now, when it comes to the virus that's going on right now, which again, I said I wasn't really going to discuss, but we're discussing it just a little bit. I've seen, again, a handful of reports of individuals that have passed away from this, and because people are inquiring, they've started to say the individual had no comorbidities. But then they post a picture of the person, and again, there's no disrespect in what I'm reporting. There is no judgment here whatsoever. This is just an observation, but they're posting a photo of an individual that is obviously overweight, tremendously overweight. Now, to look at me, and for those of you that know me, I am 20 pounds over what my comfortable weight is right now. I'm 5'10", I'm not gonna tell you my weight, but I'm 20 pounds over where I wanna be. And according to BMI charts, even for someone of an athletic build, which I like to consider myself, I'm probably 25 or 30 pounds over where the charts want me to be. And to look at me, maybe you wouldn't think that. But to look at someone who is obviously overweight, or again, according to these charts, obese, they have a considerable amount of inflammation going on. And that's why some of the memes out there and the things that people post, like, I don't have to work out, I eat right, or I only work out to look good naked. That's not what it's about. Your body was meant to move, and you need to be doing that to keep your inflammation down. And the photos, again, there's no judgment here, but photos of being very pro self-image, and no matter what your weight is, you should be proud of yourself. Absolutely, that is true. But know that if you are carrying around all of that extra weight, you're carrying around extra inflammation, and that inflammation breeds disease. There's absolutely no question there. Research shows that that is what contributes to, obviously, heart disease, site-specific cancers, breast cancers, ovarian cancer, prostate cancer, things like that. So we want to be really careful when it comes to carrying around extra weight, having that extra inflammation, all of that stress weighing us down. And because, and again, we're in the Midwest, and being a little bit overweight or obese, about, what was the last study was, in 2017, 2018, the prevalence of obesity increased from 30% to 42% of the United States population. So half of us are considered obese, and that is scary. So what does that mean? Being obese is very common, but please understand, by no means is it normal. Your body is, again, meant to move. Your body is meant to function at a certain capacity, and homeostasis, where your body's compensating for what's going on, has a threshold. So it can only do that for so long. And if you have all of that extra weight, if you have all that extra inflammation cooking inside there, there comes a point where the body's like, dude, I'm taxed and I can't do it anymore. So needing a knee replacement, or not being able to have children after 35, having this big infertility drop. All of these things are very common, but again, they're by no means normal. So we need to work on that as a whole, as a society, and this translates back to how we're able to handle our stress. So I wanted to give you guys a couple things, a few common vitamin deficiencies that I see as it pertains to our physical pains and emotional stressors. So CoQ10, again, along with this, very common, is being on a statin, being on a blood pressure medication, or a cardiovascular med. Hello, Chrissy. Thanks for tuning in. And those are very common. I had this question earlier because cardiovascular issues are complications they're seeing quite routinely with the individuals that are having issues with this COVID. And what can we do to compensate for that? So CoQ10, if you or someone that you know or love is on a statin and their cardiologist has not recommended them taking CoQ10, in my estimation, they are engaging in malpractice, because it is a very well-known fact that statins leach and they utilize your CoQ10, which leaves you as a being deficient. So please make sure that you're taking CoQ10. CoQ10 actually decreases your inflammatory cytokines, which are in charge of pain levels in the body. So please make sure that you or someone you know is taking CoQ10 if you're taking a statin. There's no question. There's no maybe I should do it. Yes, you absolutely have to be doing it. You may notice, again, if you are on a statin, about 75% of people on statins have muscle pain. So that's, again, why? Because they are CoQ10 deficient. Magnesium is another big one that is going to help with both managing stress and anxiety, as well as muscle pain. And I get this question a lot. There are a lot of different types of magnesium. So if you have your pen and paper, I want you to write this down. About 80% of the population is magnesium deficient, especially women. That's why when we're menstruating, we crave chocolate. It's high in magnesium. I don't know why we don't like crave spinach. But if you are taking magnesium, you'll notice that those cravings decrease, so you may be eating better. But what you want to be doing is paying attention to the type of magnesium that you're taking. So magnesium across the board is a muscle relaxer. The thing that makes it different or determines the type of muscle that magnesium relaxes is the salt that it's attached to. So you have a handful of options, and we're going to run down them super fast. So are you ready? Mag oxide, which is what most people buy if you're purchasing from a big box store or your corner drugstore. Mag oxide is a super, super cheap version of magnesium. I do not recommend that people take it. Yeah, Chrissy, it's really good for cramps. And we'll get to what skeletal muscle, what magnesium you should be taking. So mag oxide actually draws water into the bowels. It's absorbed by the GI tract. And so that's why mag oxide is very often used for constipation. So if you're feeling constipated and you're doing all your other stuff correctly, you're drinking your water, you're staying active, you're getting fiber, you're taking your probiotics, then yes, if you need something to help with constipation, mag oxide may be an option for you. Mag citrate is what I use most often, like Chrissy was saying, for skeletal muscle issues. So if you have low back pain, if you have leg cramps, if you have any sort of skeletal muscle tightness, mag citrate or mag glycinate is what you want to be looking for. Mag glycinate also releases serotonin, so it's terrific to take before bed. Citrate does a little bit as well, so that's why usually for my patients I recommend that they take it in the evening. You want to be taking about 100 milligrams to start, and then you can increase that depending on your size. I take about 300 to 400 milligrams before bed without any issue, and sort of like vitamin C, you want to take it to bowel tolerance. So if you notice that you're taking 200 milligrams of mag citrate or mag, now I'm losing my train of thought, glycinate, and you're having loose stools, then you're taking too much. Thanks, Latricia, for that capture there. So those are the two that I most readily recommend. If you're having migraines, and always please remember to not go out and just buy a vitamin, but please discuss this with your physician before starting or stopping any medications or supplements as well, because there can be interactions even for a lot of these benign products. So mag-threonate is amazing for any sort of brain issues. So if you're having headaches, if you have migraines, I recommend it a lot. So that's sort of a quick rundown on magnesium. What else can I tell you? So if you're having a lot of emotional stress, feel free to give me a like or a thumbs up if you're having some emotional stress right now. I can't like my own post, or I would like it like 3 times. But physical and emotional stress increases exertion. So you may notice it increases your adrenaline. Your heart is beating, digestion goes down, and that happens, and that sucks up, that utilizes all of your magnesium. So again, another reason that a lot of us in our current state of prison should be taking some additional magnesium, because it will help replete those hormones that are getting depleted because of the stress and us running through our adrenaline so fast. You also can't process vitamin D without having magnesium. And another thing that's coming out with the longer that we're aware, excuse me, of COVID, is that it seems to be affecting the individuals that are having the biggest response negatively to the infection are people that are vitamin D deficient. And that does not just mean that you need to run out and take a whole bunch of vitamin D. The 2 things you should know about vitamin D is it should always be taken with K, because that helps with absorption. My recommendation is a liquid vitamin D, because vitamin D is a hormone and it starts breaking down in your mouth. So you want to do a liquid vitamin D. But also magnesium helps you process that vitamin D. So if you're mag deficient, you can be taking vitamin D all day long and it's not going to process the way that it should. And what does Chrissy say? My body's way of dealing with stress is to give me cold. Yep. And that's very common. And there are a lot of physical responses to stress that many of us may not even notice. You may not even realize. Do I have a boo-boo? No, I do not. Christy, can everybody see? Who can identify my Band-Aid? Parker got new Band-Aids, so I got one as well. Band-Aids in our house are like super expensive stickers. So most of the time, and you may have seen him in some of my videos, like with one on his head, there's nothing wrong with him. They're just very expensive stickers. I would have to start a GoFundMe for Band-Aids in my house. And then when we really need one, when something goes wrong, we're not going to have one. But anyway, so make sure you're taking your magnesium, make sure you're taking your vitamin D. And for those of you that don't know, both magnesium, it is Woody's girlfriend. It's Jessie. Good call. So for those of you that don't know, a vitamin D deficiency can cause low back pain. Both magnesium and vitamin D deficiencies often result in depression. So if you're not feeling happy, if you're not feeling motivated, you may not need an SSRI. You may need to take a look at your vitamin levels, and you may just need to eat right. So one thing I hope you walk away from all of these talks that we're doing is that you have the power to control your mood. You have the power to control your health. Your destiny is in your hands. And that's very scary, and that's hard for a lot of people. I see a lot of patients and they're like, well, you know, my dad had diabetes, my mother had cancer, this person had this. I even had a patient tell me that back pain runs in their family. And I have learned over the years in a very nice way to hopefully educate that it doesn't work like that, and that what really runs in our family is common habits, common lifestyle. And that's why we end up with a similar disease presentation and even something like back pain. Because I can tell you, if your parents were overweight and your parents were not very active and didn't go out hiking and spend a lot of time on the couch, what are you going to learn as a child? And then what are you going to emulate? Probably those activities. What does Christy say? Glad you're okay. Sorry, distract. There's no distraction. This is what I'm looking for. Participation, people. Vitamins are essential in your life. Thank you. Love you, girl. Miss you. So, and again, just one of my tangents that I go off on, but those behaviors need to be modified to display what you want to display as an individual. So is my goal as a parent, you know, we did a lot. Jan's watching, Jan worked out, but as a family, it's not like we spent our evenings walking or we went hiking or something. And it's my goal, and the weather has sucked, to show Parker that there's fun and we can do things outside to make sure that he is as active as he can be. He is very kinesthetic. He's always moving. And I need to get, for him, for his health and well-being, whether it's his mental health or his physical health, keep him moving. And you need to make sure that you're doing that as well. So there's no bad weather. There's only bad clothing. So please make sure that you are dressing appropriately, getting outside. Even if, again, it's taking 5 deep breaths, you need to be outside, moving as much as you can, even during this. Another reason that you should be taking vitamin D during this is that it helps to promote glutathione, and that is what your main detoxifier in the body. We did a talk on toxins. Please take a look at that if you didn't see it. Hello, Jade. Thank you for tuning in. Glutathione, we want to make sure that those levels are up. Excuse me, gosh. I'm losing my voice. We want to make sure those levels are elevated so that we are getting rid of toxins. We are keeping our system nice and clean. We are able to fight off whatever comes our way. Another vitamin that can be low or that I've seen depleted in individuals that are experiencing stress and are experiencing pain is turmeric. Now, I do not have NSAIDs in my house. I utilize turmeric instead. So if I have an ache or pain, like this knuckle that's been killing me for a month, I take 2 turmeric. And if I don't feel any relief from that, I'll take 2 more. So I have some patients with extreme back pain or extreme joint pain, and I will recommend to them 6 turmeric 3 times a day. So yes, and cooking with turmeric is fantastic. Thank you for bringing that up, Christy. And not that I want to discourage anyone from cooking with turmeric, because it is terrific, but turmeric as a supplement is much more bioavailable than the turmeric that you would cook with. So you would have to be cooking and putting it in your shakes in such large quantities that you'd probably be yellow from head to toe. But if you take it as a supplement, you can get away with doing about 2,000 milligrams a day, again, depending on the pain and your pain tolerance. But it is very safe to take at much higher doses than that. So again, check with your physician before starting or stopping any products. The issue with taking an NSAID or a COX-2 inhibitor, which a lot of people do, and we're going to do a video on proper ergonomics this week because I've been getting this question like crazy, and we are in weird postures since we're home. We're sitting much more. We're not traveling. Our stress is through the roof. So I'm getting a lot of patients that are reaching for the NSAIDs, reaching for the COX-2 inhibitors. You're taking Advil, you're taking aspirin, and please don't, or Tylenol, because those will, on the one hand, deplete your glutathione, which makes you susceptible to infection, which we don't want. But they also damage joints by reducing blood supply and impairing your cartilage formation. So really watch out if you're doing any of those things. What that also allows, like if someone gets a cortisone shot, what that allows is for joint overuse because you're not having pain in the joint. Pain sucks. It sucks to hurt, but it serves a purpose. So you want to listen to those joints. You can think, you're not like a football player that gets tackled and they need to shoot you up with cortisone and send you back in so you can continue playing. Okay, that's not, I don't think, happening for a lot of us right now. So you want to listen to that pain. You want to have that pain addressed by a professional so that you understand why you're hurting. And if it's a biomechanical imbalance, you need to be seeing a chiropractor. You need to be seeing a physical therapist. You need to be restoring that functional movement pattern so that everything is moving the way that it should, so that you're not having pain. Because I will tell you, pain is very common, but pain is not normal. I was 38 when I had Parker. I did not have pain during my pregnancy. I had, yes, propensity for GI bleeds with NSAIDs, yes. I did not have any issues, any complications. I was very proactive. I ate very clean. I had an acupuncturist, obviously, chiropractor, massage therapy. I was doing Pilates. I was doing yoga every day, including the morning that my water broke. I didn't have any pain medication during my labor. I didn't have any interventions whatsoever. I had a completely natural birth. It was not pleasant by any means, but that was my goal. And the reason that I did that was because those pain signals served a purpose. I don't know where I was going with that, but pay attention to your pain. The reason I was thinking that was I hear from a lot of people that, either they can't get pregnant at an advanced maternal age, they need to have pain medication, or they need to have some sort of intervention, and not necessarily. So you need to pay attention to your body and do what it needs and what works for you, what's best. But it's not mandatory. What else? Oh, turmeric is amazing. Okay, so turmeric is going to be boosting your glutathione. And again, the reason we want that is because it's a fantastic detoxifier, and we need that with the swirling infection that's out there. So pay attention for that. What else? Oh, the last thing I want to recommend for everybody was if you're not familiar with enzymes, proteolytic enzymes are incredible, and they can be utilized in two different ways. So if you take enzymes while you are eating, if you take them with a meal, they will help digest your food. And a lot of individuals, as they age, and again, this is common, it is not normal, will have a decrease in their enzymatic activity, oftentimes as a side effect of being on a pharmaceutical drug or a secondary disease process that is going on. And what you want to be doing in those situations, if you are not digesting your food appropriately, if you are feeling bloated after you eat, if you are belching, anything like that, if you're having abdominal upset, then you may want to try taking digestive enzymes with your meals. I've been doing it lately just to see if I know that I don't feel like I'm symptomatic, but maybe I could feel better. So I've been doing that with my meals. I give Parker a chewable enzyme with his meals. He calls it his medicine, and it drives me insane. I'm trying to convince him that it's a supplement. And the other way that you can use enzymes is on an empty stomach. And what they do in that situation is they eat up inflammation. So if you are hurting, especially if it's an acute pain, if you sprain your ankle, if you're having acute onset back pain from sitting in an office at home that you're not used to, or sitting and working from your kitchen table, or maybe you're carrying kids around much more than you would under normal circumstances, then taking some proteolytic enzymes on an empty stomach may help eat up some of that inflammation and decrease your pain. So it may be worth looking into or thinking about. So if there are not any other questions, we'll wrap up this evening. And I just want you to remember that, being, let's say, not in perfect health is very common. It is not normal. As Chrissy, do you have all of these vitamins or supplements recommendations available in one pack, or do they have to be purchased separately? That's a good question. We offer if someone's hurt, okay, so yes and no. If someone's hurting, we have a product called the AIP pack, which I actually have at home because I was having a headache, or actually I'm still having headaches and neck pain right here. I was complaining on a previous video, and actually my chiropractor neglected to adjust me today, so I think that's why I still hurt. Jade, are you still watching? The AIP pack is terrific. It is proteolytic enzymes. It is the turmeric. It has a little bit of magnesium in it, but that's for short-term use. So it's 1 pack a day for like 9 days. And I've had patients that have had extreme pain that take them for like 2 weeks in a row, and that's fine. But no, typically they're all taken individually because it depends on what we need, and we try to be as specific with supplements as possible. So the turmeric, again, I have on hand, and I take it as needed. But I have a lot of patients that take turmeric daily because turmeric is amazing. And again, Christy, if you're cooking with it, keep doing that. Turmeric's anti-cancer, it's anti-aging. Like I said, it's great for pain relief. Magnesium, I take almost every evening. It helps me sleep. What else did I talk about? Vitamin D, I take every day. Parker takes every day, especially now while we're trying to improve our immune system, and because the weather's been so crummy in Chicago. That's one that you should be taking daily. I think that's everything that I touched on. So yes and no. Oh, and CoQ10. So again, depending on the individual, somebody that's on a statin, absolutely, you must be taking CoQ10 every day. That's available individually. It's also available in our women's packs and our men's packs, which have a multivitamin, an omega, and a CoQ10 in the men, and then multivitamin, omega, CoQ10, and and bone support in the women's packs. Yes, PM me. We'll talk. So yes, there are options, and there are different recommendations depending on individuals. So I wanted to remind you that now I'm losing my notes. That's okay. Difference between common and normal. So pay attention to that. When you're feeling, if you feel that you have the words coming out of your mouth, I have a normal headache, or I have normal pain, or this is normal. So the first step is recognition. So recognize that you don't feel as great as you could be. And again, whether that is you're feeling down, or you're feeling stressed, or during this you're feeling scared, you're feeling overwhelmed, that's very common, and that's okay. And that is a normal response to what's going on, but you don't have to be feeling that way. So whether, you need a pharmaceutical intervention, you need a nutraceutical intervention, you need to get out and get some sunshine, get some air, walk, working out makes you feel incredible. I've been using the Peloton every day for a week, and I'm sold, I'm addicted. Or if you need talk therapy, there's lots of resources, and they're terrific connections. So if you need somebody, feel free. Again, that is not my area of expertise, but I have some fantastic individuals I can refer you to. So please feel free to message me and reach out. My only concern is individuals that are not feeling well and that are on pharmaceutical interventions for much longer than they need to, because it is so common. Having anxiety is so common. Being on an SSRI is so common. But again, those drugs were never tested beyond 6 weeks. So if you've been on them for years, you have an opportunity to, hopefully at this point, modify your behaviors so that maybe you don't need to be on those indefinitely, because they do cause brain damage from the minute you start taking them. So let's take a look at what can be done to help you actually feel better. And coming from someone who is on some of that stuff, for me, it just masked how I was feeling. I did not feel good. I felt numb. And that's not what life is about. Life is supposed to have ups and downs. And if you feel like you're having too many downs, then absolutely, let's do something about that. So pay attention to being able to acknowledge how you're feeling, and whether that is physical discomfort, emotional discomfort, mental discomfort, and recognize that if you hear yourself saying to yourself, this is normal, understand it's not. It may be common, but it doesn't have to be. And then recognize that you are going to be proactive in attacking what needs to be done, what modifies that for you. And interventions are very different. So that's why when we did our talk on sleep, yes, we all need sleep. How are you going to get more sleep? It's very unique to you. So do you need to be going to bed earlier? Do you need to be doing your gratitude journal? Do you need to be getting exercise? Whatever is best for you. Do we need to balance your hormones so that your cortisol isn't through the roof at 3 a.m.? Yes, and yes. So each answer is going to be unique to you. You just have to find what works for you. So if you're having trouble figuring out what works for you, that's what I'm here for, or another functional medicine physician that can break this all down and help you understand the cause so that you're actually addressing the cause and not just treating symptoms. So that's where I would like everybody to start. If you need help, send me a private message. You can schedule an appointment at the office. And I appreciate you watching and tuning in on this wonderful Wednesday evening. We are going to spend the remainder of the week talking about appropriate ergonomic setup. We're going to talk about self-love. Hello, Mark. Thank you for tuning in. And a few topics to be determined. So if you have a suggestion, send me a message. I would love to know what you want to know about. I hope that you have a wonderful evening and take care of one another. Tomorrow is Thursday. It's like Groundhog Day. I should have a X on the wall again, like Andy Dufresne, where I'm tracking how many days we've been in here. So when is what, Christy? One of our topics? I don't know. I decide the day of. If I had time to plan and prep, these would probably be like 10 times better. But you guys get me with literally like 5 minutes prep time. So I love you. Thank you for tuning in. If there's questions, please feel free to send me a private message or post on here. I read every comment after. Oh, ergonomic setup. I don't know. Do you want that tomorrow or do you want that Friday? Maybe we'll do that tomorrow and we'll talk about self-love on Friday. That's my plan. So thank you for tuning in. If there's questions, post them here. If something you want to discuss privately, feel free to send me a message. If you have suggestions that work for you, if you have things I didn't talk about, please post them in the group. That's what this is here for. To learn from each other, to maybe commiserate with each other, meet each other. This is your tribe. These are people that want to feel better. And, you need to maybe be the individual to reach out. Say, how are you feeling? How are you doing? I'm doing this. Have you guys thought about your goal setting? We talked about goals earlier in the week. I want to see some people posting their goals. And what else? That's all the news that's fit to print. So have a great evening. I love you. As always, thank you for tuning in. Share this with people that you know. Post on your page, please. And if it's an individual that does not have Facebook, we are slowly uploading all of these videos to YouTube so they can find all this information there as well. Have a great evening. Thank you. I will see you later.